If you are on Medicare or helping a parent who is, I need you to watch this carefully. Because right now, in 2026, over 9 million older Americans are eligible for benefits that would significantly reduce their Medicare costs, and they are not receiving a single dollar of it. It is not because the money is not available, not because they do not qualify, but simply because nobody told them these programs exist. Hello, my name is Vivian. Welcome to Care Anchor, your health and care guide support, where we help seniors and their families navigate through the journey of aging gracefully together. According to the National Council on Aging, eligible older adults are leaving $58 billion in benefits completely unclaimed every single year. $58 billion. In this video, I am going to walk you through the 4 most important Medicare benefits and programs that seniors consistently miss, including one that can eliminate your Medicare Part B premium entirely. If you or someone you love is on Medicare and living on a fixed income, this video could be worth thousands of dollars a year. Just watch it to the end. Before we get into the programs, let's talk about where things stand in 2026. The standard Medicare Part B premium has risen to $202.90 per month this year. That is $2,434.80 every year, coming directly out of most seniors' Social Security checks before they ever see a single dollar. On top of that, prescription costs, co-pays, deductibles, and supplemental insurance premiums continue to climb for millions of retirees on fixed incomes. And while a 2.5% Social Security cost of living adjustment did take effect in January 2026, for many seniors, that tiny increase does not come close to covering the rising cost of healthcare alone. The result is a growing number of older Americans who are quietly going without medications, skipping vital doctor visits, and making impossible choices between prescriptions and groceries, all while billions of dollars in assistance programs sit completely unclaimed around them. That massive gap exists almost entirely because of one reason: awareness. These programs are completely real. The money is there. Most seniors simply have never been told about them, but that changes today. The first and most powerful program most seniors miss is called the Medicare Savings Program, or MSP. Here is what it can do for your wallet. At its most basic level, the Medicare Savings Program pays your Medicare Part B premium for you. That is $202.90 per month, which is over $2,400 per year, put back in your pocket simply by enrolling. But it goes even further than that. Depending on your income and the specific MSP you qualify for, it can also cover your Medicare deductibles, your hospital and doctor visit co-payments, and in some cases, additional prescription drug costs. There are 4 types of Medicare Savings Programs. First is QMB, the Qualified Medicare Beneficiary Program. This is the most comprehensive option. It acts like a premium shield, covering your Part B premiums, Part A premiums if you have them, plus your deductibles, coinsurance, and co-payments. The second is SLMB, the Specified Low-Income Medicare Beneficiary Program. This one is more targeted, covering your Part B premium only. Third is QI, the Qualifying Individual Program. This also covers your Part B premium, but it's designed for slightly higher income levels. And the fourth is QDWI, the Qualified Disabled and Working Individuals Program. This is a highly specific program for working individuals under 65 with disabilities. It covers the Part A premium only for those who lost free coverage after returning to work. Now, here is the part that shocks most people. According to the National Council on Aging, NCOA, the participation rate in Medicare Savings Programs is estimated at only 49%. That means roughly half of all eligible seniors, an estimated 6.6 million people, are not enrolled. They are forfeiting these crucial benefits every single year. As a senior advocate from the Center for Medicare Advocacy puts it, these programs are underutilized almost entirely because people simply do not know they exist. Who qualifies? The income limits are actually higher than most people assume. For the QMB program, a single person can qualify with a monthly income of up to $1,350. For a married couple, The combined limit is up to $1,824. Asset limits do apply, but your home, one car, and your personal belongings are typically excluded from that calculation. Even if you think your income is too high, check anyway. The income thresholds change regularly, and millions of people are surprised to find out they qualify. How do you apply? First, contact your state Medicaid office directly. You can quickly find your local office by visiting the Medicaid.gov. Remember, applications are completely free. There is zero cost to apply. If you are approved for programs like SLMB or QI, your benefits can actually be backdated up to 3 months. But keep in mind, for the comprehensive QMB program, benefits strictly start the month after you are approved, so do not wait. Apply as soon as possible to protect your wallet. The second major program seniors consistently miss is called Extra Help. It is also known as the Low Income Subsidy, or LIS. Extra Help is a federal program that dramatically reduces what you pay for prescription drugs under Medicare Part D. Here is what it covers. Number 1 is premiums for your Part D drug plan. Number 2 is annual deductibles, often reducing them to absolute zero. And the third is co-payments for covered medications, lowering them to no more than $5.10 for generics and $12.65 for brand names. The Social Security Administration estimates the average annual value of Extra Help at about $5,700 per person. That is not a just saying. Up to $5,700 per year in prescription drug savings alone. And yet, roughly 2 million seniors who qualify for Extra Help are not enrolled. That is an estimated $11.4 billion in prescription savings, going completely unclaimed every single year. Right now, millions of seniors are cutting their medications in half. Others are skipping vital doses just to make their prescriptions last longer. Who qualifies? The income limits are actually higher than most people assume. For 2016, individuals with an annual income below $23,940 can qualify. For married couples, the combined annual limit is $32,460. Your assets must also be below certain thresholds. For a single person, that limit is $18,090. For a couple, it is $36,100. But remember, your home, one car, and your personal belongings do not count toward that total. If you are already enrolled in Medicaid, a Medicare Savings Program, or SSI, you qualify automatically. No application is needed. For everyone else, apply directly at ssa.gov/extrahelp. The application is completely free, and it takes less than 30 minutes online. The third thing most seniors do not know, and this is incredibly critical for anyone who recently retired or experienced a sudden drop in income, is something called the IRMAA Appeal. IRMAA stands for Income-Related Monthly Adjustment Amount. Here is the problem it creates. Medicare calculates your Part B and Part D premiums based on your tax return from 2 years ago, not your income today. 2 years ago, that means if you retired in 2025, your 2026 Medicare premiums are still being calculated based on your full working salary all the way back in 2024. You could be stuck paying massive premium surcharges based on money you no longer earn. For 2026, just one single dollar of income above the threshold triggers an automatic surcharge of over $1,100 per year. And at the highest income bracket, that penalty can skyrocket to nearly $7,000 per year. For a retiree now living on Social Security and modest savings, paying penalties based on an old salary is a crushing and deeply unfair financial burden. But here is what most people do not know. You can appeal it. If your income has dropped due to a qualifying life event, and retirement absolutely qualifies, you can file Form SSA 44 with the Social Security Administration. This reports your current lower income and requests an adjusted premium. The qualifying life events include retirement or a reduction in work hours, the death of a spouse, divorce, the loss of income-producing property, or the loss of pension income. When completed correctly and approved, some retirees have successfully reduced their Medicare premiums by over $500 every single month. The steps are simple. First, download Form SSA-44 from ssa.gov. Second, complete it with your updated income information. And third is you submitting it to your local Social Security office, either in person or by mail. Make sure to include supporting documentation such as a retirement letter or your most recent tax return. Do not wait for the annual enrollment period. You can file an IRMAA appeal at any time. The sooner you file, the sooner your premiums can be corrected. The fourth area where seniors are leaving money on the table involves massive structural updates that most people have not fully registered yet. Change number 1 is the Medicare Part D out-of-pocket cap. There is now a strict annual cap of $2,100 on your out-of-pocket prescription drug costs under Medicare Part D. Before this historic change, there was no true ceiling. Seniors with expensive medications could face catastrophic drug costs that easily ran into tens of thousands of dollars every single year. That protection now exists. The hard limit is $2,100. For anyone taking multiple premium or specialty medications, this change alone could save you thousands of dollars annually. So, if you have not reviewed whether your current Part D plan is still the most cost-effective option under these modern rules, make sure to do that during the next Medicare open enrollment period. Remember, that window strictly runs from October 15th to December 7th, each and every year. Change number 2 is the Medicare Advantage Part B Giveback benefit. This is easily one of the most overlooked Medicare Advantage perks. Certain Medicare Advantage plans, not all, but a very substantial number of them offer what is called a Part B premium reduction benefit. Online, it is often referred to as the Giveback benefit. Here is what it means for your wallet. The plan actually reduces the standard $202.90 Part B premium that you are currently paying each month. Some plans reduce it by $50 a month, some by $100, and some by even more. This is not a traditional coupon or a discount. It is a direct reduction to your Medicare premium, which is returned straight to your monthly Social Security check. Most seniors on Medicare Advantage plans have never actually looked at whether their plan offers this benefit or whether switching to a plan that does would save them money overall. But here is the massive catch you must watch out for. Giveback plans sometimes have narrower doctor networks or different drug lists. So before switching purely for the extra cash, verify that your current doctors and vital medications are still covered. You can review and compare all of these options using the official Medicare Plan Finder tool. Over at Medicare.gov, before we wrap up, the single most useful tool for any senior or caregiver trying to navigate all of this is a free resource called Benefits Checkup. It is run entirely by the National Council on Aging at benefitscheckup.org. All you do is enter some basic information, like your age, location, and income range. From there, it shows you every federal and state benefit program you are likely eligible for. This includes Medicare Savings Programs, Extra Help, SNAP food assistance, utility assistance, and housing support. All of it in one single place. It is completely free and it takes only about 10 minutes. For many seniors, it instantly reveals thousands of dollars in annual assistance they had no idea was available to them. The National Council on Aging has confirmed that over 9 million eligible older adults are currently not enrolled in programs they qualify for. Do not let that be you or your family. If you have not used Benefits Checkup yet, or encouraged a parent or older relative to try it, please do it this week. To bring everything together, here are the 4 massive Medicare benefits most seniors never use. Number 1, Medicare Savings Programs. These can eliminate your $202.90 monthly Part B premium entirely. Around half of all eligible seniors are missing out. Apply for free through your state Medicaid office. Number 2, Extra Help for prescriptions. This is worth up to $5,700 per year in drug savings. 2 million eligible seniors are missing it. Apply for free at ssa.gov/extra help. Number 3 is the IRMAA Appeal. If you retired recently and your income dropped, You are likely overpaying your premiums based on old tax returns. File Form SSA 44 with Social Security to request an immediate correction. Number 4, the Part D $2,100 cap and the Part B Giveback. These are vital protections that fundamentally change the cost calculations for anyone on expensive medications or enrolled in a Medicare Advantage plan. And for everything else, start at benefitscheckup.org. It takes 10 minutes, it is completely free, and it could change everything for you. $58 billion in benefits goes unclaimed by older Americans every year. That money belongs to the people who earned it. Please, kindly share this video with every senior you care about, a family member or friend on Medicare. One single share could be worth thousands of dollars to someone you care about. Were you aware of any of these programs? Kindly share with us your experience every week. We cover topics that are beneficial to you and the vital programs designed to help seniors live with dignity and financial security, all explained clearly with zero confusing jargons. If this video helped you or someone you love, please subscribe to Care Anchor for more healthcare information and tips. Like, share, leave us a comment below. We read every comment and would like to hear from you. See you in the next video. Thanks for watching.